Yes, a very good morning to all. In a running chapter, the body fluids and circulation. Uh, Last few topics are left. Let's wind up with this. Uh, our next topic, the structure of blood vessels. Structure of blood vessels. If you can recall, I mentioned that the human circulatory system is made up of three components. The circulating fluid, that is blood, we have studied extensively. The pumping organ, that is heart, again we have gone through it in a detail. In the same topic, detailed information is being gathered by us. Last but not the least, the circulatory pathway, which is made up of blood vessels. As you know that ours is a closed circulation, so right from the heart to the body organs and from body organs back to the heart, there is a closed circuit, closed circulatory pathway, and this pathway is made up of blood vessels. Ideally speaking, there are five types of blood vessels. I told you an artery which enters into an organ gives rise to branches which are called as arterioles, and further branches which penetrate between the cells, not in the cells, between the cells. They are called as capillaries. On the other hand, the capillaries reunite to make venules, and several venules join to make vein, and vein shall emerge out from the it will emerge out from the organ. So that's the basic concept that you have to remember, that there are five different types of blood vessels: artery, arterioles, venules, and veins. In between them, capillaries. For a while, if we keep aside the capillaries, for remaining four, that is artery, arterioles, and venules and veins, there is a common plan of their structure. They all are tubes with lumen surrounded by the wall, and in this wall there are three layers over there. Let me show you and explain the same. First of all, tunica externa, then tunica media, and then tunica intima. Tunica intima. If you see, three-layered wall around the artery or vein, typical blood vessel, artery, arteriole, venule, and vein. Three-layered wall in which outermost is called tunica externa. That's the outermost layer. Same here in the same in this tunica externa, tunica media, and tunica intima, like that. As you know, tunica externa is outermost layer. It is made up of fibrous connective tissue along with the collagen fibers. Collagen fibers and fibrous connective tissue make up the outermost layer. Next, the tunica media, the middle layer. This layer has got smooth muscles and elastic fibers. Look at the composition, position and composition. Tunica media, it is made up of smooth muscles and elastic fibers over there. Then comes the innermost, that is called as tunica intima, squamous endothelium. Remember that squamous epithelium, flattened cells, single layer of cells. So that type of squamous epithelium here, it makes inner layer, so it is called squamous endothelium. I'll see if I have another diagram to make the things further more clear. Yeah, here you can make out with bit more clarity. Outer layer, tunica externa. Middle layer, tunica media. Innermost, tunica intima. Outer layer is made up of which material? Tell me. The outer layer is made up of which material? Tunica externa. Collagen fibers. Zanil, correct. And what? Collagen fibers and what? Fibrous connective tissue. Galav is most appropriately giving answer. Yeah. Fibrous connective tissue with collagen fibers. The middle layer known as tunica media. Which are the constituents of the tunica media? Tunica media. Smooth muscles and elastin fibers. Yes, that's correct. And tunica intima, the innermost layer, is made up of what? Squamous endothelium. Rishi and others are correct. Now you can see that both are having the same plan, whether it is the artery or vein. The walls are having same plan. Just the difference. Can you make out the difference between the two? The wall of the two. Can you make out the difference? Yeah. Which one's wall is thick? And yeah, which one's wall is thicker? Artery. Which layer is thicker? Middle layer, smooth muscle layer. Do you know why? Why should the arterial middle layer be thicker? Why should there be a thicker? High pressure. Zanil is correct. When blood is coming in the arteries, it is blood that is being pumped by the heart. So it comes with immense pressure. This pressure is exerted on the wall of artery from inside. This pressure can rupture the artery. So to resist against that pressure, it has got a very thick wall, which is made up of smooth muscles and elastin fibers. A lot of elasticity it provides. But because its wall is very thick, its diameter is narrow. So its lumen diameter compared with that of vein, it is narrow. So very thick tunica media and a narrow lumen. That is the feature of artery. For vein, a very thin tunica media comparatively and a broader lumen. क्योंकि एक्सटर्ना और इंटीमा तो सेम होते हैं दोनों का जो मेन डिफरेंस है वो ट्यूनिका मीडिया वाले पार्ट का ही होता है. अच्छा, वन मोर डिफरेंस दैट यू कैन पॉइंट आउट इज दैट इनसाइड द आर्टरी देयर आर नो वाल्व्स थ्रू आउट. बेस पे एक बार होता है, वो भी कॉमन पल्मोनरी ट्रंक एंड एओर्टा के बेस पे, बट इन बिटवीन देयर आर नो वाल्व्स. वेन में रेगुलर इंटरवल पे ये वाल्व्स प्रेजेंट होते हैं. So when the blood is passing forward, it doesn't come back. So to prevent the backflow of blood, veins carry valves in them. So three differences I have pointed out. Arterial wall is thick because of thick tunica media. Its lumen is narrow and it is devoid of any valves in its lumen. On the other hand, veins, their tunica media is thin, so overall thin walls. They do have valves and their lumen is larger. In fact, because of the larger lumen at any point of time, veins carry more amount of blood than that of arteries. Look at this profile. 30% blood in arteries, 5% in capillaries, and maximum amount 65% in veins at any point of time in the circulation. हमारे बॉडी में 5 to 6 लीटर ऑफ ब्लड होता है, तो या तो वो हार्ट में है या और पैरेलली ब्लड वेसल्स में है. सो ब्लड वेसल्स में जितना भी होता है, हार्ट में मैक्सिमम कितना रहेगा? 100-200 ml, उससे ज्यादा नहीं हो सकता है. सो जो भी 5 लीटर ब्लड है वो मेनली circulatory pathway made up of artery, arterioles, venules and capillaries में होता है. So artery, arterioles में 30%, venules में 65% and capillaries में just 5%. Very narrow lumen they have. That's why they have a less amount of blood in them. बोलिए, आपको concept clarity मिला? आपको last point capillary भी एक बार explain कर दूं आपसे, so that capillary में क्या है कि wall is made up of single layer instead of 2 or 3 rather, tunica, intima, media and externa. It is having only squamous endothelium on a basement membrane. A very narrow lumen surrounded by a single layered wall where mainly the cells are squamous endothelium cells with a basement membrane. That actually permits the capillaries to carry out exchange of materials with the surrounding. I hope you can recall now, the capillaries are the ones through which the constituents of blood come out, plasma constituents mainly, and they constitute interstitial fluid. याद है आपको, capillaries are permeable one. So that is the profile of blood vessels. Next is the profile of blood circulation. See, it's the closed circulation because throughout the circulation, blood remains confined to the blood vessels and heart. Second, it is double circulation. I hope you remember double circulation. Complete double circulation in 4-chambered heart. Birds and mammals and few crocodiles like reptiles with 4-chambered heart, they have to have a complete double circulation. Now, internally within this circulation, human circulation, if we see the parts of it, so there is something what you call as the pulmonary circulation. Now, what is a pulmonary circulation? So from right ventricle, what arises? From right ventricle, what arises? Pulmonary trunk. This pulmonary trunk gives rise to what? Which arteries? Pulmonary arteries. They carry the blood into which one? Lungs. From lungs, blood is taken by which vein? Pulmonary vein. And pulmonary vein go and open into which part of the heart? Exactly. Left atrium. So this circulation between heart and lungs, deoxy blood from right ventricle via pulmonary trunk via pulmonary artery goes to the lungs. There it gets oxygenated, and via pulmonary arteries it has been brought into the left atrium of the heart. This is the pulmonary circulation. This is called as the pulmonary circulation between heart and lungs. Another one is between heart and major body parts, most of the body parts over there. Simple. What arises from left ventricle? Dorsal aorta. Dorsal aorta gives rise to what? Arteries. These arteries carry the blood into what? Body parts, the oxygenated blood. And from them, blood is collected by various veins. These veins in the form of superior and inferior vena cava, they open into which part? Right atrium. All these arteries are called as systemic arteries. Systematic nahi. Systemic arteries. All these veins are collectively known as systemic. So blood, oxygenated blood from the left ventricle via dorsal aorta through systemic arteries, it is taken to body parts. From body parts, deoxy blood collected by systemic veins, finally by vena cava, poured back into right atrium. This circulation between between heart and body parts, it is called as systemic circulation. This one was pulmonary circulation. The other one is systemic circulation. Systemic circulation. Tell me, from left ventricle, what arises? Dorsal aorta. Which arteries arise from the dorsal aorta? Collectively known as what? Exactly. They carry which blood into the body parts? Oxygenated. Body parts, after using the oxygen from this blood, they convert the blood into deoxygenated blood. From these body parts, deoxy blood is collected by which veins? Systemic veins. All the veins, major vein, number of veins, systemic veins. Pulmonary vein is not a systemic vein, by the way. These systemic veins finally open into two major veins. Which are they? Vena cavas. Very good. And vena cavas open into right atrium. Right. Very good answer. So this is how between heart and the body parts, it's a systemic circulation. There is a third one which is not much described, mentioned. So we won't go in detail, but there is a third one which is called as cardiac circulation. Cardiac circulation. It is actually between heart, from heart to heart. That is from heart to heart. The way you saw the pulmonary circulation is between heart to lungs. The way you saw that systemic circulation is between which two? If pulmonary circulation is between heart and lungs, then systemic circulation is between heart and body parts. Absolutely right. Galav and Zanil, as usual. Very good reply. And then cardiac circulation must be between dash and dash. Heart to heart, isn't it? Interesting one. You see, heart is pumping the blood and providing the blood to lungs, to all body parts. It also provides blood to its own self, and that is the cardiac circulation. Of course, the details are not required, so I'm not going into too much of detail, but can you make out that some of the arteries are even providing blood into the heart itself? Can you make out this? And veins carry the blood back into the heart. So heart has its own network of blood vessels which will supply blood and collect the blood from the wall of the heart. This is the cardiac circulation. उसमें coronary arteries आती है. Coronary arteries are part of it. I'll show you the arteries and veins on the superficial view. Look at this. Can you make out these arteries and these veins? Can you make out these arteries and veins? Arteries to provide blood into the heart wall and veins to collect back this blood. So it's a cardiac circulation, what I was talking about. But there is a fourth component of human blood circulation, and that component is here. This is called as portal circulation. This one is identified as which circulation? Portal circulation, specifically hepatic portal circulation. Here, what happens is that blood is provided to the liver with the help of hepatic artery. Okay, blood is also been provided to the let us say our alimentary canal. Here you got to imagine that there is an alimentary canal. So alimentary canal receives blood From the aorta, one branch goes to liver also. So एक liver में जाता है एक branch alimentary canal में आता है. Alimentary canal का blood, instead of going directly back into the veins and into the superior and inferior vena cava particularly, rather it is जैसे for any organ, just think about any organ other than the digestive tract. So it receives one artery to collect the blood, and from it one vein will emerge out that will go and join ultimately in the vena cava. But the veins which are coming out from the alimentary canal, these veins, instead of going back and joining with the vena cava, they go and open and capillarize into the liver. This is called as portal system. You have been informed about it in a frog's circulatory system, that in vertebrates there are portal systems where a vein emerging out from the organ, instead of going directly towards heart, it enters into some intermediate organ and opens into it in the form of capillaries. Then the vein is called as portal vein. If this intermediate organ is a liver, then it is called as hepatic portal vein. Then it is termed as hepatic portal vein. And the system is called as portal circulation. This is called as portal circulation from one organ to another organ, from alimentary canal parts to liver. A hepatic portal vein, rather arising from this alimentary canal, rather reaching to the vena cava directly, it will open into the liver. From intestine and other parts, it will arise and will open into liver. This is called as portal vein, hepatic portal vein, and the system is called as portal circulation. Kushali madam, have they learnt about portal circulation in frog?
Yes, sir.
Okay, fine. So guys, it's not a new thing for you. Already you have learned about it. So generally you saw that heart to heart cardiac circulation, heart to lungs pulmonary circulation, heart to body parts systemic circulation. This is about uh, alimentary canal to liver, and this is called as hepatic portal circulation. Which is the another type of portal circulation other than hepatic portal, which is even found in frog? Yeah, it's a renal portal circulation. Fine. Now, before we go to the next, and that is the disorders of circulatory system, as already I have completed the parts of human circulation: pulmonary, systemic, portal, and cardiac. These are the four parts. I would first give you a break for 5 minutes, and then we'll resume the work and we'll go to the next topic, that is disorders of circulatory system. Kushali madam, so let's see the last topic in the chapter. The disorders of circulatory system is our last topic. Related to every system, you must have studied about the diseases, disorders. Digestive system also is completed. Respiratory system is also completed. So you must have studied about some of the disorders over there. Same manner with our circulatory system also, we got to study about certain disorders. Mind you, from the exam point of view, particularly the competitive exams such as NEET exam, generally they ask about these disorders, diseases related with the various systems. Per chapter, you will find the last topic or last few topics related to these disorders and our exam point of view very, very important. Okay. First in this list, hypertension. Generally, we call it as a high BP issue. hypertension. Normally, our blood pressure, what is this blood pressure all about? So when ventricles contract and pump the blood, particularly left ventricle pumping the blood into aorta and further into arteries and arterioles, up to that, the blood is being pumped. The pressure exerted on the blood at that time while it is passing through these arteries, that is termed as blood pressure. Normal blood pressure is normally 120 by 80 mm of Hg. First of all, this pressure is measured in terms of mercury level. So, level of mercury in that column, that is millimeter of Hg. The instrument by which you measure it, it's a sphygmomanometer. आपने देखा होगा ना, एक belt is been enwrapped around your upper arm, and then one tube which is leading to a balloon like structure which has been pressed by doctor, and another tube connected to that column of the mercury in that sphygmomanometer. And also parallelly doctor is using the stethoscope and hearing the pulse over there. So that is the kind of old one. Nowadays, and improved ones are also available, isn't it? Have you seen one belt and one tube connected to that small digital machine on which within within a few half minute or so immediately आपको पता चल जाता है कितना blood pressure है. So that is about the blood pressure measurement. 120 by 80 mm of Hg. 120 is a systolic pressure and 80 is the diastolic pressure in a normal condition. अब ये क्या होता है? So when our heart is pumping the blood, at that time the ventricular systole, those 0.3 seconds period during each heartbeat, that first stroke with which the blood comes out in the aorta and subsequently in the systemic arteries, that pressure is the systolic pressure. It tends to be higher and it is generally 120 mm of Hg. Normal person, normal condition. Uh, Later, if you see, immediately after those 0.3 second, remaining 0.5 second, wherein your ventricles remain in a diastole, again at that time, with that initial stroke of systolic pressure, there will be some pressure of the blood on the walls of artery. That pressure is known as which one? Diastolic pressure. It will be lesser than the systolic pressure. तो जो systolic and diastolic है, that is in context of your ventricular systole 0.3 seconds and ventricular diastole, that is for remaining 0.5 seconds within one heartbeat or a cardiac cycle. How many have understood systolic pressure and diastolic pressure? Upper pressure and lower pressure, also we use the terms. Okay. Now, normally the pressure tends to remain 120 by 80, systolic, diastolic. Of course, these values can vary from person to person in a normal condition. किसी का normal systolic भी 130 और 90 हो सकता है, या 120 by 90 हो सकता है. और आजकल तो UN ने, I mean UNICEF of course, that medical related branch, तो उन्होंने अभी तो कंसिडर कर लिया है कि 120/80 की जगह पे 120/90 इज द नॉर्मल ब्लड प्रेशर, ऐसा. तो ये वैल्यूज थोड़े आगे पीछे चलते हैं, इतना ज्यादा भी डेंजरस नहीं है to have the difference of 5 to 10 units either side. Problem is that persistently for long duration, if your blood pressure remains higher, जैसे 140/90 over a long period of time, then you call it as hypertension condition. This in a long run causes damage to your brain. It can even damage to your kidneys. Kidneys में जितना ज्यादा प्रेशर हमारे बॉडी में होगा ना, ब्लड में, उतना ज्यादा फिल्ट्रेशन होगा, किडनी पे उतना ज्यादा स्ट्रेस रहता है, क्योंकि जितना फिल्टर ज्यादा निकालोगे उतना ज्यादा रीएब्जॉर्प्शन करना पड़ेगा. सो किडनीज लॉन्ग रन में फेल होने का चांस, ब्रेन में स्ट्रोक होने का चांस, ये सब कंसिक्वेंसेस रह सकते हैं हाइपरटेंशन के. एंड ऑफ कोर्स हार्ट अटैक कैन आल्सो बी seen in this scenario in a long run. Have you all understood what is a hypertension? Do you have anything to ask? Generally, most of the men, particularly amongst the parents, you may see that fathers are the ones who are suffering from these problems. Multiple reasons are there. The gender issue, males में ज़्यादा prominent होता है problem, food habits, lack of exercise, tension, all these issues are responsible for such scenario. So proper food has to be taken with less amount of fatty stuff, proper exercise, stress-free life. These are the things which can help in overcoming the problem of hypertension. In cases where it is persistent and uncurable by these things, then the medication is the last option left. Then comes CAD, coronary artery diseases. Coronary artery, what's the specialty of coronary artery? Coronary artery क्या है special? हाँ, it arises from the heart and it supplies blood to the heart itself. So health of this artery has to be the best because it has to supply blood to the heart. जो सबको ब्लड देता है, खुद उसको ब्लड देने वाली आर्टरी कौन सी है? कोरोनरी आर्टरी. So it is necessary that its health, its feature should be normal. What is the major problem faced by the coronary artery? Have a look. The materials such as calcium ions, calcium salts, then fat, cholesterol, and other fibrous tissue, they have a tendency to accumulate in the wall of coronary artery, and then they make the lumen narrower. Narrowing of the arterial lumen, particularly in coronary artery, that is called as arteriosclerosis. Arteriosclerosis. मैं आपको एक पिक के थ्रू एक्सप्लेन करता हूं ये क्या है. Just see. एथेरोस्क्लेरोसिस, आर्टीरियोस्क्लेरोसिस होता है और दूसरा होता है एथेरोस्क्लेरोसिस. दिस इज एथेरोस्क्लेरोसिस. Look at the healthy artery. This is its lumen, and here is its wall, smooth wall. Now in this wall, as you can see, there is a deposition of materials. Have a look. This fatty stuff and calcium salts, etc., gradually they get uh, deposited in the wall. So what happens when they get deposited? Well, you can see that the lumen of this artery, that lumen is becoming narrower. See, it became narrow and further narrow. This narrowing of the lumen of an artery because of the deposition of such materials, that is termed as atherosclerosis. Make a correction in spelling, it's atherosclerosis. See, in this process, what has happened is the blood supply is been obstructed. Full flow of blood which was there, it got reduced, and ultimately here it gets stopped. So the heart wall may not get the enough blood supply. If it happens, the heart wall can be damaged without blood. So here is something what you saw is the narrowing of lumen of artery, particularly coronary artery. This is called atherosclerosis. It occurs in stages. It's not overnight issue. In a healthy artery, gradually these materials get deposited and buildup begins. Some stage the buildup raises in the form of a projection into the lumen, that is called as plaque. And whenever this plaque ruptures, it can cause clot formation, and clot can literally block the artery and stop the blood supply. What is to be done in these cases where angiography can reveal that you have a narrowing of arteries? So doctor suggests that you better go for angioplasty, by which you can get rid of this problem, atherosclerosis problem. You can restore your normal blood supply. I'll be explaining about angioplasty as a solution against atherosclerosis, but let me first complete the topic. The another one is angina. The inadequate oxygen supply to heart muscles causes acute chest pain, more common in middle-aged and elderly people. Generally, heart की efficiency जो होती है वो low हो जाती है. So its own pumping efficiency is declining. Moreover, with the increasing age, the atherosclerosis effect gradually increases until it is blocked. The blood supply is continued, but the amount of blood supply is reducing gradually. जैसे किसी का ब्लड वेसल इस स्टेज में है, लेट्स से ये हमारे यंग स्टेज में होता है, फिर एज एज प्रोग्रेसेस इट गोज टू दिस लेवल. सोचिए अगर इस लेवल पे आता है तो blood supply is not been blocked, but definitely it has been reduced. तो इससे क्या होता है कि blood supply to the heart wall, particularly oxygen supply to the heart wall, may reduce a little bit, and that may at times cause pain in the chest. चेस्ट में हार्ट के मसल्स में पेन आता रहता है, जिसको एंजाइना कहते हैं. ओके, एंजाइना पेक्टोरिस भी कहते हैं. अच्छा, एक और प्रॉब्लम, heart failure. Okay, when heart is not pumping the blood effectively enough to meet the needs of body, this is also called as congestive heart failure. Due to the congestion of lungs, heavy heart condition आती है. First of all, to explain heart failure. If heart is supposed to pump, let's say, if heart is supposed to pump 70 ml blood per stroke, per beat, so it will come to, I think, 5040 ml per minute, isn't it? अब इसकी जगह पे let's say that heart is able to pump, let's say that it is able to pump 3000 ml blood per minute. So we say that blood's working efficiency is reduced to 65%. अगर इसकी जगह पे ये 2000 ml पंप करता है या 2000 ml, we say that its working efficiency has been brought down to how much? 40%. Do you understand? It hasn't stopped. It hasn't stopped pumping. It has reduced its efficiency, so its effectiveness is reduced. It's not that it has stopped pumping. 5000 ml जो एक्चुअली पंप करना है उसकी जगह पे वो 3000 या 2000 ml या 2500 ml पंप करे, तो we say it is not pumping the blood effectively. Can I say it is not pumping the blood at all? मुझे एक बात बोलो, 100 मार्क्स की एग्जाम हो रही है, उसमें 35 इज अ पासिंग स्कोर और किसी का अगर 25 स्कोर आता है आउट ऑफ 100, should I say that a child has failed or should I say that child has stopped studying? What is the better way to describe this child? He has failed. He has not read effectively to pass out. I can't say that he has stopped studying. स्टॉप कर देता तो 0 मार्क्स आता, आप समझ रहे हो? इसी को ही मैं अगर एक्सप्लेन करूं तो दूसरे टर्म में कार्डियक अरेस्ट इज व्हाट? हाउ इज इट डिफरेंट फ्रॉम कार्डियक फेलियर और हार्ट फेलियर? दोनों में क्या डिफरेंस है? समझ में आया आपको? I hope now you have understood. Our heart is pumping, let's say 3000 ml blood per minute, and it is 0 ml blood per minute. It has stopped. कंडीशन ए एंड कंडीशन बी. ए कंडीशन के लिए कौन सी टर्म होती है? हार्ट फेलियर, एग्जैक्टली. और बी कंडीशन के लिए कार्डियक अरेस्ट. दैट्स अ वेरी गुड अंडरस्टैंडिंग गाइस. सी लॉजिकल है. Cardiac arrest means it has stopped working at all, completely, no pumping. Whereas heart failure means it pumps, but it is not pumping effectively. अगर ये दोनों का डिफरेंस आपको समझ में आ जाए तो आप कभी भी कोई आपके साथ हार्ट के बारे में बात करें ना कि कोई मर जाता है तो कहे हार्ट फेल हो गया. हार्ट फेल नहीं हुआ, कार्डियक अरेस्ट हुआ. हार्ट फेल तो तब तक होता है जब तक आप अलाइव हो, क्योंकि पंपिंग तो चल रहा है. Heart failure indicates ineffective pumping. It doesn't indicate stoppage of pumping. You get the idea what I am explaining? जब भी समझ में ना आए ना तो समझ लेना, किसी के 0 मार्क्स आए और किसी के 25 मार्क्स आए तो पहले वाले की जो सिनेरियो है वो he has stopped reading, दूसरे वाला है he has read but has failed. So ऐसे ही हार्ट अगर पंप नहीं करता है तो कार्डियक अरेस्ट, और इनइफेक्टिवली पंप करता है, सफिशिएंटली पंप नहीं कर पा रहा है, उसको कहते हैं हार्ट फेलियर. एंड जब भी ये हार्ट फेलियर मींस पंपिंग एफिशिएंसी डिक्लाइन होती है तो लंग्स के अराउंड फ्लूइड अक्यूमुलेट होना स्टार्ट कर देता है. इसीलिए लंग्स पे प्रेशर आता है जिसको कहते हैं कंजेशन ऑफ लंग्स, और इसीलिए इस कंडीशन को कंजेस्टिव हार्ट फेलियर भी कहते हैं. ऐसा And last but not the least, the heart attack, myocardial infarction. वो जो मैंने एक्सप्लेन किया था आपको, उसी के दो स्टेजेस की डिस्क्रिप्शन है ये। कि आप इमेजिन करें कि अगर ये पर्सन सिचुएशन के थोड़ा ब्लॉकेज हो गया है and blood supply is reduced, sometimes oxygen shortage is created in the heart muscles. तो condition, इसके लिए कौन सा वर्ड यूज करेंगे? कौन यूज करेंगे अगर ब्लॉकेज स्टार्ट हुआ है, थोड़ा बड़ा है, ब्लड फ्लो रिड्यूस हुआ है, ऑक्सीजन सप्लाई कम होती है, मसल्स में पेन होना स्टार्ट होता है, दैट इज कॉल्ड एज एंजाइना। ओके, और ये ब्लॉकेज 90% गया और so that part of the heart not receive enough blood, suddenly these regions, heart muscles are damaged.
Sorry, your
Heart
voice is
muscles, heart muscles to oxygen supply. Hello, am I audible? Hello,
yes,
hello.
sir.
So for example, when the second thing comes, that is up to 30-40%, let's say 50%, 60%, 70%, up to which if there is a blockage, so blood supply reduces, so oxygen shortage created, and pain occurs in chest, in particularly heart, that is the angina pectoris. But let's say 95%, 100% blockage, blood supply stops completely, so that part of the heart may not receive blood for short duration. And in that period, the heart muscles start dying even. And अगर आपको याद हो तो heart muscles never recover then. तो इस सिनेरियो को कहते हैं हार्ट अटैक. दिस इज कॉल्ड हार्ट अटैक, या इसको कहते हैं मायोकार्डियल इंफारक्शन. मायोकार्डियल इंफारक्शन, दैट्स द अनदर नेम ऑफ द प्रॉब्लम. देखो, दो डिफरेंट मैग्नीट्यूड का इश्यू है. जैसे पंपिंग का भी मैंने दो डिफरेंट मैग्नीट्यूड्स दिखाया ना, कम पंपिंग करना एंड पंपिंग स्टॉप करना. कम पंपिंग करना इज हार्ट फेलियर, पंपिंग स्टॉप करना इज कार्डियक अरेस्ट. एंजाइना और मायोकार्डियल इंफारक्शन में भी है कि कम ब्लॉकेड के लेवल पे ब्लड सप्लाई थोड़ा रिड्यूस्ड होने से, ऑक्सीजन सप्लाई लेस होने से जो चेस्ट पेन होता है, these are the early signals के later it might turn out to be heart attack. और अगर ब्लॉकेड 90% या उससे ज्यादा हो तो ब्लड फ्लो रिड्यूस क्या स्टॉप ही हो जाता है ऑलमोस्ट लिटरली. तो देन द हार्ट मसल्स स्टॉप गेटिंग ऑक्सीजन कंप्लीटली and they start dying, permanent damage to the heart muscles. This is known as heart attack or myocardial infarction. अगर हार्ट को अटैक आता है और वो ब्लॉकेज को ओपन कर दिया जाए, and if blood flow is restored, then the person can recover from that heart attack. अगर वो हार्ट अटैक के बाद उसका ब्लॉकेज रिमूव करके ब्लड फ्लो रिस्टोर अगर नहीं किया जाता, if the blood flow is not restored, then that heart attack may end up with cardiac arrest. Do you understand what I'm explaining? किसी को हार्ट अटैक हुआ है अगर, और उसका ये ब्लॉकेज अगर इंस्टेंटली रिमूव करके ब्लड फ्लो को रिस्टोर कर दो, तो पर्सन कैन रिकवर. And if this blockage is there and if not opened up, blood flow is not restored, then the person may not survive. Simple as that. अल्टीमेटली अगर नहीं सर्वाइव कर रहा है तो हार्ट विल स्टॉप बीटिंग. तो उस स्टेज को तो फिर क्या कहेंगे? कार्डियक अरेस्ट. Let me explain one of the technique by which you can open up this heart blockage, and that technique is called as angioplasty. एंजियोग्राफी से आप डिसाइड करते हो कितना ब्लॉकेज है, एंजियोप्लास्टी में आप उसको रिमूव करते हो. Now here you can see the blood vessel having lot of deposition in its wall, and you can see that the narrowing of blood vessel has taken place more than 50%, so significant narrowing is there. Now how do you open up this passage? That's the challenge. In this one, from the from the arms or else from the leg region through your artery, one wire is introduced into your arterial system, that is called as catheter. This wire is inserted into the artery, and through that, through the arterial route, it is brought into the heart, and there it is inserted into the artery, that artery of the heart wherein the blockage is present. उसमें उसको insert किया जाता है, like this one. Can you see this? Catheter inserted into that passage of blocked passage of the artery. Can you make out that? And then at the position where there is this catheter inserted, this wire is inserted, through another wire, they introduce a balloon in that region. And then they dilate the balloon, inflate the balloon. balloon में air fill होता है उस point पे लाके. देखिए जैसे balloon inflate हुआ, can you see that passage is opened up over there? Can you make out that passage is opened up over there? With the help of catheter, the balloon is introduced into that position between the blockade region, and then balloon is inflated so that it will open up the passage. And around the balloon, one metallic net, which is called as a stent, it is been inserted. So along with balloon, that stent is brought into that position. और वहां पे inflate होगा balloon, तो stent भी inflate होगा, expand होगा, और वो fit हो जाएगा वहां पे. और जैसे ही वो फिट हो गया, बलून को वापस क्या कर लेते हैं, डिफ्लेट कर लेते हैं और रिट्रैक्ट कर लेंगे कैथेटर और बलून को. एंड व्हाट विल बी लेफ्ट बिहाइंड ओवर देयर? दिस स्टेंट. ये एक मेटालिक स्टेंट है. बिकॉज इट इज मेटल, इट विल मेंटेन इट्स शेप, so it will open up this passage throughout. It will keep this passage open throughout over there. So that is how the stent will work. I sent one video to you. Hello, are you all there?
Yes, sir.
Yes, sir.
Okay, now, first thing, with this information and this topic, I conclude the chapter. In a next regular lecture, we will have a continuity in which ma'am will start with the chapter 19, that is excretory system. She must have started, then she will continue further. Okay, so that will be the next thing. Here we conclude the lecture. Just stay in the lecture. Ma'am, you just stop the recording.